Introduction to mental health and illness. What is mental health? Mental health refers to a person's emotional, psychological, and social well-being. It affects how we think, feel, and behave in daily life. Good mental health enables individuals to handle stress, relate to others, and make decisions effectively. Key components of mental health. White heavy checkmark emotional well-being, ability to cope with emotions. White heavy checkmark cognitive function, thinking, memory, and decision-making. White heavy checkmark social interactions, healthy relationships with others. What is mental illness? Mental illness includes a wide range of disorders affecting mood, thinking, and behavior. These conditions can interfere with a person's daily life and require medical or psychological intervention. Common types of mental illness: mood disorders, depression, bipolar disorder. Worried face anxiety disorders, generalized anxiety disorder, panic disorder. Speaking head and silhouette psychotic disorders, schizophrenia. Stop sign personality disorders, borderline personality disorder. Neurodevelopmental disorders, autism, ADHD. Causes of mental illness. Mental illness is caused by a combination of biological, psychological, and environmental factors. Microscope genetics, family history of mental disorders. Scales chemical imbalances, imbalance in brain neurotransmitters, example, serotonin, dopamine. Broken heart trauma and stress, childhood abuse, accidents, or chronic stress. Smoking, simple substance abuse, drugs and alcohol can worsen mental conditions. Globe showing America's environmental factors, social isolation, financial struggles, and lack of support. Signs and symptoms of mental illness. Polyscars, revolving light, emotional symptoms. Persistent sadness or irritability. Mood swings. Feelings of worthlessness. Polyscars, revolving light, cognitive symptoms. Difficulty concentrating. Confusion or irrational thoughts. Memory problems. Polyscars, revolving light, behavioral symptoms. Withdrawal from social life. Changes in sleep and appetite. Engaging in self-harm or reckless behavior. Dash. Why mental health awareness is important? 1. Keycap reduces stigma, encourages people to seek help. 2. Keycap prevents suicide and self-harm, early diagnosis saves lives. 3. Keycap improves productivity, mentally healthy people perform better in work and life. 4. Keycap enhances relationships, strong mental health fosters better personal and professional connections. According to the World Health Organization, WHO, mental disorders are a significant global health concern, impacting individuals across all demographics and regions. Key statistics include: prevalence, in 2019, approximately 1 in 8 people. Worldwide, totaling 970 million individuals were living with a mental disorder. The most common conditions were anxiety and depressive disorders. Adolescents, around 14% of the world's adolescents experienced mental disorders in 2019, highlighting the importance of addressing mental health early in life. Disability, mental disorders are the leading cause of disability globally, accounting for 1 in 6 years lived with disability. Suicide rates, suicide is a significant concern, responsible for over 1 in 100 deaths worldwide. Notably, 58% of suicides occur before the age of 50. Life expectancy, individuals with severe mental health conditions have a reduced life expectancy, dying on average 10 to 20 years earlier than the general population, primarily due to preventable physical diseases. These statistics underscore the critical need for enhanced mental health awareness, early intervention, and accessible care services to address this pervasive issue. Continuum of mental health and mental illness. The continuum of mental health and mental illness represents mental well-being as a dynamic spectrum rather than a fixed state. It highlights how individuals can move between different levels of mental health depending on various biological, psychological, and social factors. Dash. The mental health continuum model. The continuum is often divided into 4 main stages. 1. Keycap flourishing mental health, optimal well-being. At this stage, individuals: white heavy checkmark experience positive emotions, resilience, and life satisfaction. White heavy checkmark have strong relationships and a good sense of purpose. White heavy checkmark manage stress effectively and maintain stable cognitive function. Pushpin example, a person with good mental health enjoys social interactions, handles stress well, and feels fulfilled in daily life. Dash. 2. Keycap mild or temporary distress, common stress and anxiety. At this stage, individuals may experience mild anxiety or sadness due to life events, example, work stress, exams, or financial worries. Occasional sleep disturbances or lack of focus. Short-term emotional struggles but still function well overall. Pushpin example, a student feeling anxious before an exam but recovering after studying, or relaxation techniques. Dash. 3. Keycap moderate mental health problems, persistent struggles. At this stage, individuals may experience ongoing anxiety, mood swings, or irritability. Have difficulty concentrating, sleeping, or maintaining relationships. Feel overwhelmed or withdrawn, but still manage daily responsibilities with effort. Pushpin example, someone struggling with prolonged work stress leading to frequent headaches, irritability, and difficulty sleeping. Dash. 4 keycap mental illness, severe dysfunction and impairment. At this stage, individuals large red circle experience long-term or severe mental health disorders, example depression, schizophrenia, bipolar disorder. Large red circle have significant distress that interferes with daily life, relationships, and work. Large red circle may show signs of self-harm, suicidal thoughts, or psychotic symptoms, example hallucinations, delusions. Pushpin example, a person with major depression who struggles to get out of bed, avoids social interactions, and has suicidal thoughts. Dash. Key takeaways. White heavy checkmark mental health exists on a continuum, and people can move between different states. White heavy checkmark early intervention in the mild to moderate stages can prevent progression to severe mental illness. White heavy checkmark lifestyle changes, therapy, and medical support can help individuals improve their mental health.